This call is now being recorded.
Perfect. So health promotion. We've looked at malaria, its causes, symptoms, and treatments, and what we can do to prevent the malaria. Now we look at health promotion. Health promotion. Okay? Health promotion is the provision of information or education. Did I stop that presentation or it's still on? I'll stop the presentation because I'll present later. Health promotion is the provision of information or education to individuals, to families and communities that encourage family unity, community commitment, and traditional spirituality that make positive contributions to their health status. Health promotion is also the promotion of healthy ideas and concepts to motivate individuals to adopt healthy behaviors. So under health promotion, we are going to look at what is health promotion, and we are going to critique health promotion programs. I want us to define the term health promotion. And I want us to go back to history. According to the World Health Organization, in 2005, at Bangkok, there was a charter that was held for health promotion in a globalized world. And they said, or they agreed, that health promotion is the process of enabling people to increase control over their health and its determinants, and thereby improve their health. This requires the development of a health public policy that addresses the prerequisites of health, such as income, housing, food, security, employment, and quality working conditions. Health promotion also calls for lifestyle change, which can be facilitated through a combination of learning experiences that enhance awareness, increase motivation, and build skills. Most importantly, health promotion demands the creation of opportunities that open access to environments that make positive health practices the easiest choice. Thus, health promotion requires efforts of all stakeholders in health. Accordingly, the Ottawa 1986 Conference on Health Promotion observed that health promotion demands the coordinated action by all concerned, the government, the health and other socio-economic sectors, non-governmental and voluntary organizations, local authorities, industrial, and the media. So they said that it requires multi-approach. The Ottawa Conference also noted that health promotion should be adapted to the local needs and possibilities of individual countries and regions to take into account their differing social, their differing cultures, and their differing economic systems. Now, having said this, I want us to think through health promotion. health promotion. I gave you a link on the LMS, a link that takes you to health promotion. And on that link that talks about health promotion, that link tells us that health promotion is the process of enabling people to increase control over and to improve their health. So when you have control over your health and you are able to improve your health, then that is health promotion. Health promotion is also a set of actions to foster good health and well-being. Now, I've given you the historical definitions of health promotion from the Bangkok Conference and also from the Ottawa Conference, and now the most recent definitions of health promotion. So the one that gives you power, or control over your health, and the one that helps you improve your health the way you want to. And the second one is the one that says it's a set of actions, not just one action. Action 1, 2, 3, a set of actions that help you to foster good health and well-being. When we talk about promotion, when you hear the word promotion, there is some sense of understanding that you derive from that word, promotion, to promote, To promote, literally, promotion is about telling people how to look after their health so that it can be improved. There are some actions that we can take that you'll say these ones will count on individuals' health promotion. And one of these actions is to inform people of what they could do to stay healthy. And if you go across this content, this course, how we've been looking at and analyzing is actually how to help people, to inform you as the stakeholders, as the teachers of tomorrow, how to actually stay healthy. And we said knowledge is power. We also said our health is our wealth. So we are informing people of what they can do to stay healthy. Another action is to address the things in the community that influence health and well-being the most, so that this can be supported. Health promotion activities are geared towards promoting health and preventing ill health, rather than focusing on people at risk for specific diseases. So health promotion deals with promoting, doing activities that will help people to promote their health. So when you focus a particular group, let's say teenagers and drugs, then that's an action, yes. But then we are not referring to a target group. It is the whole population, what needs to be done so that we can improve our health. So health promotion activities are geared towards promoting health and preventing ill health, rather than focusing on people who are at risk. Focusing on people who are at risk is something else. But health promotion, we focus on everybody. Now, health promotion enables people to increase control over and improve their health. That is one. So when people are able to have control of their health, then that's something else. Health promotion involves the population as a whole in the context of their everyday lives. Activities are geared towards promoting, that is the health promotion activities. They are geared towards promoting health and preventing ill health. And like we've said, it's not about focusing at a risk for specific diseases. Now, having said that, I want you also to know that health promotion is a rich area of ideas, approaches, and research. So, if you want the bite size, have to begin to understand it, okay? I've already talked about the Ottawa Charter that was there. It was held in Canada. Ottawa is in Canada. It was held in November 1986. And the conference that was held, its aim was actually for action to achieve health for all. It was called Health for All, you know? And they wanted, because that was in 1986, they wanted by the year 2000 and beyond, the charter to give birth to promotion of a solid framework and health promoters an identity. So they wanted it to have an identity. Yeah? Now, the question you should be asking yourself is that, does health promotion work? And I will tell you from research and case studies from around the world, these provide convincing evidence that health promotion is effective. Health promotion strategies can develop and change lifestyles and have an impact on the socio-economic and environmental conditions that determine health. So when you hear research and you hear case studies of what has happened and how things have been progressing, then that should tell you actually that health promotion works. And a lot of what we've been doing in this course is health education and health practices. Health education will help you to understand the health, and the practices that you've learned will help to promote your health and the health of those around you. Are we in agreement, Kisa?
Yes, Daktari.
Perfect. Then what are the strategies for success when we are thinking health promotion? There are 5 strategies set out in the Ottawa Charter. The Ottawa Charter is the one that you said was held in 1986 in November. That is in Canada. Remember, Ottawa is in Canada. And they came up with 5 strategies. And they said these strategies are essential for success. 1, building health public policy. Building a healthy public policy. Okay? 2, create supportive environment. Supportive environment. 3, strengthening community action. 4, developing personal skills. And 5, which is the last but not the least, reorient health services. Reorient the health services. Now, when we talk about the strategies for success, then we need to talk about the Vic health approach. The Vic health approach. The Vic health approach is informed by the International Health Promotion Framework, in particular, those led by the World Health Organization and encapsulated in the Ottawa Charter. in Canada for health promotion, which we now call WHO 1986. We also have the Jakarta Declaration, which we call WHO 1997, which was later. And we also have the Rio Declaration, which we call the WHO 2012. So you see, the 1986 WHO Declaration is a very important charter for us when we think about health promotion, the strategies for its success, because it's from it that it became a springboard for what happened in 1997 and what was declared, and also what happened in 2012 and what the declaration was thereat. Now, we need to, when we talk about the VIC approach, we need to understand our approach is based on the knowledge, and the health is influenced by myriad complex and interrelated factors. Interrelated factors, multifaceted. These multifactors, or the interrelated factors, or the myriad complex, because it's not one thing, one factor, it's many of them. These ones include one, individual behaviors and beliefs. Note that an individual will have many behaviors and beliefs. So if you put 10 people together, their behaviors and beliefs will all count. That's why we're saying it's complex, it's multiple, it's myriad complex, it's interrelated factors. 2, family environment, not just one environment, family environment. Yeah, family 1, family 2, yeah, their beliefs, their culture, all of them combined together, family environment. 3, community and work cultures. 4, practices and policies. And 5, which is the last and not the least, broader socioeconomic factors. And these broader socioeconomic factors have to do with culture, registration, now here governments come in, the media, and economics, okay? Now, when we talk about health promotion development, the last few years that have been important for health promotion, with attention focused on the prevention agenda by both the state, the Commonwealth government. Now we are thinking globally, we are thinking the world, we are thinking all these declarations from the Ottawa to the Rio and what they came up with. So we are thinking states, we are thinking Commonwealth governments. And that is in response to significant changes causing an increase in chronic disease. This includes both demographic changes, growth, and aging of the population. Those are the demographic changes. And changes to lifestyles. Yeah? What have you been eating traditionally and what are you eating now? The increase in chronic diseases. And how it will continue to impact on the societies and communities, and the impact it will have on our healthcare system and prevention are seen by all levels of government, and we can say it's very key. The key policies related to health promotion in all those declarations that were made acknowledge that other policies of government impact on health. Yeah? When countries decide on what to do with its health, like in Kenya, health was devolved to counties. that devolving of health to counties has its impact on the health of the people. For example, the planning, the transport, the environmental suitability, the partnerships, etc. Partnerships will be needed across all levels of government, the inter-counties and counties and national governments, the non-government organizations like the Cancer Foundation, the HIV and AIDS Control, the World Health Organization, the health sector, the businesses. Like now we have COVID, and I want someone to unmute and tell us who are the big players when it comes to vaccines production in the world, because it has been a big debate. In this debate, there are key personalities that are mentioned. Yeah. And we also have bodies that regulate. Have we been following? Do we know what is happening? Have we heard about Melinda Gates and Gates Foundation? Have we heard their role on vaccine? Or we don't follow?
We do follow to some extent.
You follow to some extent. So all these key players will determine what really happens and what goes where. You know, the health sector, businesses that are involved in production of vaccines and drugs. Yeah, you know, we have original drugs. The original drugs are created by the company that comes up with the idea, and then we have generics. So original drugs are very expensive, and in most cases, they are developed and consumed by the developed countries. Let's say when we have blood infection, you have bacterial infection, you have got viral infection, your blood is cooking a virus and you need a strong broad spectrum antibiotic. The best we have Zinat. It is expensive. We have, what do we call it? Augmentin. It is good and it is expensive. Now, those are good drugs. They are original. They are produced by companies that come up with the idea. Then there are other companies that are given that party license, and they go and say, we want to produce these drugs now cheaper for the developing countries. Let's say specifically for Kenya, for African countries that are developing. Which are the developing countries that you know? Kisa, Chombo, Daisy, Eunice, Rachel.
Kenya.
Yeah, Kenya is one, I think. Which others do you know?
Nigeria.
Uganda, Tanzania, Nigeria, Rwanda.
South Africa.
So, yes, all these, but South Africa is even way ahead of us. Maybe they'll go back with whatever is happening in the country right now. But now all the developing countries, another company will go and say, give us the formula that you're using to produce this drug. Produce a generic of it, not original, a generic with your formula. They agree on the business, how much money they will, whether it will be free, whether it will be charged, you know, the third party license. Once they agree, the company goes to create that treatment, that drug, the specific drug, sorry, not treatment, the specific drug using a bottled formula through the third party license. Now these are the drugs you hear, these are generics.
Now, the first company that approaches the main company gets the second generation license. Then another one goes to that one and says, we can even produce a cheaper one. We need a third, a fourth, a fifth, and a sixth generation going that way. That's why you have so many generics. Some are not able to cure anything. You must repeat the dose and repeat, or you drop that dose and go for the doses that you could not afford, the original drugs of the same, and so on and so forth. So why did I mention this? It's not part of our class. I wanted you to see the health sector, how governments and organizations impact on it, and the businesses and the community itself, if change is to be successful. So now it's from governments, county governments and national governments, and other governments if it's in other countries, because not all countries have county governments and then one national government. Some have just one national government, like our neighbors, as we want for devolution. But then again, let's say Meru County can agree with this, let's say, second generation producer of this drug to produce for Kenya. Like for vaccines, you see now the country and to make arrangements for vaccines to be made specifically for Kenya, whereby it is manufactured, then it's brought in Kenya, and Kenya packages it now and starts. That's the vision we have. And then now it's given to people direct. Yeah? So it comes in bulk, and then Kenya packages it to give to the population. So now we send the key policies related to health promotion are important. We talked about policies in the government, how they impact the health, the planning, the transport, the environmental sustainability. I think you've learned a lot with this COVID-19. You had some centers could not even have coolers where these drugs could be stored. So this is an issue of policy. Yeah, an issue of policy now in the county government because health is devolved, and also to the national government, which has given the drugs to the county governments, and now county governments could not take these drugs, the vaccines, to every corner of the county because some dispensaries, some places did not have cooler box to store the vaccines. You understand? And this brought out a lot of policies, inefficiencies that have been there in existence. Then partnerships. Yeah, Meru County agrees with this company that produces a generic drug, maybe second or third generation. Then another county goes, okay, Irene says her phone has a problem. Okay, because I think I asked her a question to respond and she couldn't. So then another county, let's say Kakamega County or Mombasa County where you are, they have agreed with another company, maybe with the license of fifth or sixth generation to produce the drug. Now, the more the generation of drugs that are available, the second is always as good as the first. The third, the fourth, the fifth, the sixth, they become weaker and weaker and weaker as we go. As also they would cost less money. So now when it comes to partnerships, we need to think whether we want to go for businesses and our communities and think what is the best for them. Key events and outcomes. Now, key events that have been held on health promotion development across the globe. There was a mental health plan that was held in 2015. This plan sets a long-term vision. It set a long-term vision for improving mental health and well-being. You can agree with me, in Kenya today, we are having a lot of mental health issues. You've seen, you've heard the story about Kangogo. She's Kangogo who?
Caroline.
Caroline. Yes, you've heard about her case. Last night you heard about the man who killed. Mute your microphone. Last night you heard about a man who killed 5 girls and buried them. That one is a mental problem. You know, mental health conditions are serious. Remember when we defined health education, we said mental health is very, very important, just like financial health is, you know. So mental health is one thing that is affecting the world. In the US, you hear someone went on a shooting spree. Yeah? In our parliaments, you see people fighting with chairs or even verbal ones. That one is a reflection of our mental health and well-being. We said that in the start, but I want to show you that actually in 2015, December of 2015, how many years ago? 6 years ago, the world met over what we call Victoria's 10-year mental health plan. And they discussed how investments should be done on health and what should be aimed at to provide better mental health outcomes, in particular for Victorians, which is now a plan that we borrow for the whole country. Now, we have so many Victorian health well-being plans. After the 2015, there was one that lasted from 2015 to 2019, you know. And this one outlines the government's key priorities for the next 4 years. So from September 2015 to September 2019. Those are 4 years plan. And this plan was to improve the health and well-being of all Victorians, and particularly the most disadvantaged. And this is a plan that needs to be adopted elsewhere. Then again, the same Victorian health and well-being outcomes framework was developed again and to be followed through from August 2014. Now this one runs all the way to 2022. So the Victorian health and well-being plans are in existence, and this is because they realize mental health is a serious condition. Yeah? And the government needs to focus on this issue very, very well. The Victorian health system covers the spectrum from primary, secondary, and tertiary. You remember, we said those three will determine what happens in the health sector, okay? The primary, the secondary, and the tertiary health services to health promotion. Now, the Victorian framework focuses on 1, metropolitan health framework, 2, rural and regional health plan, and 3, health capital and resources plan. You see, some diseases are not covered by the insurances, and this overstretches the burden of people to be able to take care of their health needs. Having said this, I want to take you to a video. Allow me to share my screen again. I take you to a video that will help you to understand health promotion. Okay? Health promotion. So allow me to share my screen because I've talked too much so that you can hear from others. So I'm starting to share my screen. Okay. There we go.
health promotion, a very important part of public health and an essential component in any public health program. We'll talk about what it is and have a look at the Ottawa Charter, which outlines some of the important principles of health promotion. So, what is health promotion? Health promotion is defined as the process of enabling people to increase control over and to improve their health. In essence, health promotion is about improving health. But what is health? Well, the World Health Organization defines health as a state of complete physical, mental, and social well-being rather than a mere absence of disease or infirmary. Good health
That again is the definition that we borrowed.
Is not determined by a single factor. A variety of factors such as social, environmental, and economic conditions have an impact on health. These factors not only impact health, but can also make it easier or more difficult for people to make changes to their health. Because of this, health promotion tries to improve health not only by targeting people at an individual level to change their behavior, but by taking a comprehensive approach addressing a broad spectrum of health factors and determinants. Over time, the importance of health promotion has received global attention. In 1986, the first International Conference of Health Promotion was organized by the World Health Organization. It was held in Ottawa, Canada. An outcome of this conference was the creation of a document called the Ottawa Charter. This was a landmark document and has been influential in providing guidance to the goals and concepts of health promotion. The principles set out in the Charter are still used in health promotion activities. Since the meeting in Ottawa, there have been other international health promotion meetings which have expanded on other health promotion themes. Now, let's take a closer look at the key components of the Ottawa Charter. The Ottawa Charter describes 5 action areas and 3 strategies to achieve health. Let's talk about the action areas first before we get into the strategies. The 5.
So I hope you're following me because this video is kind of summarizing what I've just talked about. So what you missed from me, then again, you can learn it from this particular video. And I hope you're putting your notes down.
The action areas are building healthy public policy, creating supportive environments, strengthening community action, developing personal skills, and reorienting health services. Building healthy public policy is the process of developing policies that support health by not only protecting the health of individuals and communities, but also making it easier for people to make healthy choices. This is done by a coordinated approach of legislative, regulatory, organizational, and taxation changes. Healthy policies are not made just by health departments, but from all levels and sectors of government and other organizations. Few examples of healthy public policies are
including public participation, whereby you and I can also give our individual comments.
Laws requiring people to wear seatbelts and helmets, smoking restrictions, and workplace health and safety regulations. Moving on to creating supportive environments. The environment that people live in, both the natural and built environment, are closely linked to their health. This action area focuses on places that people live in, their communities, where they work, learn, or play. It aims to increase the ability of people to make health-promoting choices while in those settings. Some examples of this are activities such as promoting health in the workplace, restrictions on junk food advertising for children, and strengthening links between environments and people like walking or running programs. The next action area is
this advert of Indomie comes to my mind. When Indomie is advertised as a strong meal that will build you, make you this and the other. Well, you and I know Indomie will not do what the advert says it will do. So governments have a duty to regulate what is being advertised, because what is being advertised will have an impact on our mental health. You know, because what you see being advertised, you will have to go buy and see. I remember Indomie is something I am to go and buy because it was coming on the advert every other day, and my kings wanted to also try this Indomie. And I had a rough time trying to tell them that actually Indomie is not this or it's not the other, and I would rather you eat this and the other. But they had to go and we had to go and buy so that I cook, because the advert was coming on a daily basis. The knowledge was there. They needed to try it and feel. And yeah, then I am to go on with my education. There is something else you can eat that is better, that will give you 1, 2, 3, you know.
In community action, this refers to the collective efforts of communities to improve their health. To give you some examples, community fun runs that promote people to be active, community kitchens that promote healthy eating, and community-based organizations that support people living with HIV/AIDS.
Do you have community kitchens? Do you have community fund runs? Do you have support organizations? Support organizations, yes. But these other things, community kitchens and community fund runs, may not be available for the communities, maybe for sports and athletics, you know, and schools. That is where we'll have community kitchens, not a place where the community goes and, you know, cooks and eats together.
Are all community efforts to improve health. The fourth action area is reorienting health services. Health systems have traditionally been medically dominated and they're focused on an individual's curative and treatment needs. This action area aims to make health systems focus more on supporting the needs of people and communities for a healthy life. It takes into consideration the total needs of an individual. Encourages health services to focus on strengthening protective factors, reducing risk factors, and improving on the social determinants of health. Let's look at some of these.
So if you know you are diabetic, if you know you have blood pressure, if you know you have acidity problems, then that is an individual, you need an individual plan because you have got some risk factors in you. And so your health practices will be basically targeting your need, your areas of need, you know? So let's continue watching and learning.
Examples of reorienting health services. These include training doctors to assess and educate patients to stop smoking, establishing health educator roles within medical centers to coordinate preventative activities, and improving access to health services for culturally and linguistically diverse populations. Lastly, developing personal skills focuses on supporting personal and social development. This is done by providing information, education, and enhancing life skills to make positive health choices. Examples of this are online programs that provide information on heart disease, distributing educational material on the effects of diabetes, classes that teach people on how to manage disease. Now that we've covered the 5 action areas, let's talk about the 3 strategies that the Ottawa Charter identified for health promotion. These are to advocate, mediate, and enable. To advocate is to use a combination of individual and social actions to obtain political commitment, policy support, and social systems that support a health goal. To mediate is the process by which different interests, individuals, and communities, and also different sectors like public and private sectors, are reconciled in ways that promote and protect health. To enable means that health promotion activities to improve health are taken in partnership with individuals so that they're empowered to take actions to protect and promote their health. And that's the overview of health promotion and the Ottawa Charter in a nutshell.
Thank you for watching. I will take you again to another video where we're going to still look at health promotion. Sorry for that. This will be our 3rd video. I will show you one more after this one.
Hi, and welcome to this video on the social determinants of health. This is a very important concept to understand because its impact on the health of individuals.
So the first one, as highlighted, the Ottawa conference. We said that one is a very important conference because it lays the foundation of a lot of many other things. It came up with strategies, it came up with action plans on what governments and individuals and societies need to do to improve health. Okay? Now, this other video focuses on social determinants of health. So, watch and learn.
And of populations. We'll be taking a look at what it is, how it impacts health, and a useful framework to understand it. Take a look around you, your family, friends, and other people around you. What's clear is that health is very variable, not just between individuals, but also across different population groups. Let's take an example. In 2015,
we actually looked at that and we said our health is our biggest wealth. You know, if you don't have good health, you cannot go to school and concentrate. You cannot go to work and work. You cannot eat to build your body. You know, nothing matters when health is not taken care of.
The life expectancy of a child born in Sierra Leone was 50 years, whereas in Australia it was 83 years, a difference of 33 years. But there are differences even within countries. For example, in Australia, the life expectancy of Indigenous people is about 10 years lower than that of non-Indigenous people. Within a population, health is also influenced by social status. People with higher income, a higher level of education, and a better occupation have better health and a greater life expectancy. Health status can change as well. For example, studies of migrants have shown that the type of diseases, health behaviors, and risk factors are different in migrants compared to those in their country of origin. So why is there so much variability? To answer that question, we must understand the factors that can influence health. Let's have a look. A person's health is influenced by a range of factors called determinants of health. These include who they are, individual factors such as age, sex, genetic makeup, and also what they do. This includes their health behaviors such as smoking, physical activity,
not forgetting culture,
alcohol use. Health is also largely influenced by the conditions in which people are born, grow, live, work, and age. These include their social and community networks, socioeconomic, cultural, and environmental conditions that people live in, and also health systems. These are collectively called the social determinants of health.
Okay, can someone give me the social determinants of health? Grace? And today people are still in this class.
Chombo, Abby,
Environment.
Culture, environmental,
and that
Health
one will be
systems.
given. Yes, health systems, very key. Network, socioeconomic. Yes. I want them just to confirm you're there. Let's proceed.
Determinants of health are ultimately shaped by the distribution of money, power, and resources at an international, national, and local level. They have a marked influence on health inequities, which is the unfair and avoidable health differences between different groups of people within countries or between countries. Now, there are many different social determinants of health, working across many levels and with complex interactions between them. So, to understand and explain how these determinants influence and interact with each other to affect health and well-being, several models or frameworks have been proposed. There are many different frameworks that do this, but let's have a look at one useful framework developed by the World Health Organization. According to this framework, there are two broad types of health determinants that influence health and can lead to health inequities. These are structural determinants and intermediary determinants. Structural determinants refer to the socioeconomic and political context in which a person is born into and lives in. These include governance, how society organizes itself to make and implement decisions, economic, social, and public policies, and also social and cultural values that communities place on health. These factors can determine and lead to the unequal distribution of material and monetary resources, which shapes a person's socioeconomic position. The socioeconomic position describes a person's place in society, which can affect their exposure, vulnerability, and outcomes to conditions that have an impact on their health. The socioeconomic position is determined by a number of factors such as education, occupation, income, gender, race or ethnicity, and social class. The socioeconomic position, in turn, affects the intermediary determinants of health. These include material circumstances, like the quality of housing, the financial means to buy healthy food, clothing, or other requirements for healthy living, and also the work environment, psychosocial circumstances, like stressful living circumstances, relationships, and social support, behavioral and biological circumstances. In addition to these, health systems have an impact on the type and quality of healthcare available to people. It also determines how easy it is for people to access health services and receive the healthcare they need. Social cohesion and social capital are factors that bridge the structural and intermediary determinants. They describe the willingness of people living in a community to make sense for a wider benefit. Intermediary determinants influence health and health inequities. It's also important to know that the links between these different factors are not always linear, but are complex and can go in both directions.
You see, that's a summary of the social determinants of health. And as he's winding up, I hope you've learned something, because now you know how health is going to be affected, impacted.
For example, poor income and education can impact health. And also, poor health can limit opportunities for people to participate in the workforce or receive education. Also, if population is affected by a lot of disease, it can have a broader impact on the socioeconomic and political context. So how can we change or influence these determinants? Addressing the social determinants of health is not an easy task. It involves identifying the structural and intermediate determinants of health and taking appropriate actions to improve them. To do this requires actions across all sectors of society and at all levels, including local, national, and international. The actions will depend on the existing socioeconomic and political context, resources that are available, and commitment for action. And that's a quick introduction to the social determinants
of health, what it is, how it affects health, and the framework. And that was a very self-explanatory lecture. And I know you've been following and learning. I want to take you to our last video for this particular class today. Then again, you watch and follow.
It's the state of complete.
This one is on the determinants of health. Determinants of health.
Physical, mental, and social well-being, not just the absence of disease or infirmity. And good health is something we strive to achieve, not just individually, but also as a community. But if we look around us, our family, friends, and others, we know that health is very variable. For example, in 2016, the life expectancy of a child born in Sierra Leone was 53 years, while in Australia, it was 83 years. But even within Australia, the life expectancy of Indigenous people is about 10 years lower than that of non-Indigenous people. And even within a specific group of people, health can change based on a person's income, level of education, or occupation. So why is health so variable? To answer that question, we must understand the factors that influence health. The factors that influence a person's health are called determinants of health. These include who they are, such as age, sex, and genetic makeup, and what they do, as in health behaviors such as smoking, physical activity, alcohol use, and diet. Health is also largely influenced by the conditions in which people are born.
I watched a program where someone, a nutritionist, was saying, you are what you eat. So now this other person is telling you, you are what you eat, you are how you exercise, you are what you do, your lifestyle literally determines who you are.
Grow, live, work, and age, collectively called the social determinants of health. The social determinants of health are shaped by the distribution of money, power, and resources at an international, national, and local level. These can lead to health inequities, which is the difference in health between different groups of people that is unfair and avoidable. Let's take a look at the social determinants of health using a framework developed by the World Health Organization. According to this framework, there are two broad groups of health determinants: structural and intermediary. Structural determinants are the socioeconomic and political context that people live in. It includes governance, economic, social, and public policies, and also the social and cultural values placed on health issues. These factors can lead to the unequal distribution of material and monetary resources, which can shape a person's socioeconomic position. Socioeconomic position is characterized by education, occupation, income, gender, race or ethnicity, and social class. The structural determinants of health operate through a set of intermediary determinants that impact a person's exposure, vulnerability, and outcomes to factors affecting their health. These include material circumstances, such as the quality of housing, the financial means to buy healthy food, clothing, or other requirements for healthy living, and work environment. Psychosocial factors, like stressful living circumstances, relationships, and social support. Behavioral and biological factors. In addition to these, health systems determine the type of healthcare, the quality of it, and how easily accessible it is. Bridging the structural and intermediary determinants are social cohesion and social capital. The links between all these determinants are not always linear, but can be complex, interdependent, and interact in many different ways to influence health. For example, poor income can limit opportunities for achieving good health, and conversely, poor health can limit opportunities for people to participate in the workforce. And remember, these determinants act across the course of a person's life. So, the next time you think about a health issue, consider not only who they are and what they do, but also the conditions in which they are born, grow, live, work, and age. Because if we understand and act on them, we can build a healthier world for everyone.
Perfect. We can build a healthier world for everyone, me and you included. All right? I want to stop there, and then we will do our last lecture next week on Monday. And the topic that we'll be covering is health promotion programs. Health promotion programs. Health promotion programs. So today we've looked at health promotion, what it is, critiquing it. So we have actually, when are you doing your exams? Or we can do another.
August.
August when? What date in August?
26th to 30th.
Okay, so then we have 2 more topics to go. We will look at health promotion programs next week. And then after that, we'll look at preventive health practices. Any question for today, class? Or did you want us, we continue a little bit on the health programs? Class rep?
Excuse me. I have a question, Doctor.
Yes.
There is part that you talked about generic. I'm sorry for my voice. There is part that you talked about generic medicines.
Yes.
I actually wondering about these drugs. I was trying to find out, are they effective like their original? Yeah, that was my question.
I already answered that. I said when the original company manufactures a drug, another company can manufacture that drug for countries that cannot afford the original drug because they're mostly expensive, and they operate on a that license. So I said second, generic drugs are equally good. But when you go to 4th, 5th, and 6th generation, I think then the quality goes down. Okay?
Is it indicated that it is 4th or 5th generation?
When it's always indicated in the literature, I think.
Okay, thanks, doctor.
It's supposed to be indicated there. It's supposed to be indicated on the, if it's operating on a land. And if you ask the doctors, they know, they'll tell you, this one is a good generic. This other one, leave it. They won't say, no one will tell you a generic is bad. They'll tell you it's for those that will not afford this one. Okay? So you're given options, you're told, I'll go for this one or go for the other, but if you cannot, then go settle for this one. That should tell you the quality levels of those drugs. Because your physician knows and the pharmacist knows. Okay, too much information for the consumer. Okay. I guess we are done. We will continue on health promotion programs. But when you get any medication, always request for the literature. The literature is written information about the drug. It's always put in the package. So when you buy something, you can always request, please give me the literature, or you go and Google that drug and you'll get the literature for it in case it's not available. Okay, so then we can call it a day. I want to wish you all the best in your activities assignments. And I want to hear, what have you learned today, Grace, Kisa, Kilimo, Sarah? What have you learned today? And today the number is very few, you're only 14. You wengine wako wapi? What have you learned today?
We have learned about malaria, and also we have learned about promotions of health promotion.
Okay, what mosquito causes malaria?
Anopheles mosquito.
Right.
Female anopheles.
Yeah, anopheles mosquito. And we said it is basically spread by female mosquitoes. So don't imagine a male mosquito is biting you. But sometimes they will. When there is nothing to eat, when there are no fruits, rotting fruits for them to eat, they will come and bite you. But very rarely. They would rather go for fruits. Okay, Mariana, what have you learned? Rachel, what have you learned?
I've learned about malaria, causes of malaria, generic medicines and the original medicines, advantages of using generic medicines, using the original medicines, and how the generic medicine came to be.
Hey, you see, that was of interest to you. I thought you've done a lot of health promotion. You people have only singled out at the generic and original drugs. Yani health promotion hiyo ingine yote imeenda wapi? The strategies, the actions, the Ottawa, declaration, the 2015 declaration, the mental health declaration, hizo zimeenda wapi? Unaona sasa vile watu wanaenda tu vile vitu wanataka kujua. Jemima, mute your mic. All right. I think people have learned something. Then I will call it a day. I'll see you next week, God willing. Bye.
Thank you.
Thank you, Doctor. Bye.
Night.
Good evening, doctor.